In this video, let us look at Epulis. Epulis means upon the jaw, upon the gum, okay, upon the gum. So what is upon the gum? A solid painless swelling is upon the gum. So look at this. Upon the gum, can you see a fibrous epulis here and a granulomatous epulis? So fibrous epulis is where this is most common, fibrous one, and granulomatous is the one that is going to be soft, and it can be soft, this one, and it can bleed on touch, okay. So that is granulomatous. Fibrous is most common, okay. So this, remember, epulis is a solid painless swelling. Painless, remember, it is a solid painless swelling upon the jaw, that is along the alveolar margin of the jaw. Upon the gum, alveolar margin of the jaw, okay. So this you can see. The which is most common? Most common is fibrous. This is the commonest. So here a simple fibroma arising from periodontal membrane presence on the gum, okay. So it's arising from the periodontal membrane, and this can undergo sarcomatous change. It's a firm polypoidal mass and it is slowly growing and non-tender. This can undergo sarcomatous change. Can undergo sarcomatous change. This is the most common one, so we have put it first. Then you have granulomatous epulis. This is the one that is soft, right? This is the soft one. So basically here, why does it happen means because of caries, etc. they are saying. But this looks like a very small baby. From where will caries and dentures and poor oral hygiene come in such a small baby? Anyways, here you can see that there is a soft to firm fleshy mass which bleeds on touch. It bleeds on touch. It is soft. It bleeds on touch, granulomatous. And in pregnancy, a variety of this can be seen, and that is called as Gingivitis gravidarum. So if they ask you Gingivitis gravidarum, just write this granulomatous epulis. Okay, are you understanding? Are you with us? What are we looking at today? We are looking at epulis. Epulis types, you have seen fibrous, then granulomatous. Then you have the giant cell epulis. This is called as, also called as myeloid epulis. Like we have nothing much to remember. They give extra names to these things. Myeloid epulis, it is an osteoclastoma arising in the jaw. Oh, this is osteoclastoma. Osteoclastoma in the jaw, arising in the jaw. It presents as hyperemic vascular edematous soft to firm gums with indurated, that is hard, underlying mass due to expansion of the bone. It may ulcerate and result in hemorrhage. Okay, this can ulcerate, result in hemorrhage. X-ray shows bone destruction with the ridging of walls, pseudotrabeculation. So this can show bone destruction, pseudotrabeculation. Okay. So this is the osteoclastoma of jaw. Do you know what osteoclastoma itself is? In all the types of bone tumors, where is osteoclastoma? That's nothing but giant cell tumor, right? So here you can see it is affecting the epiphysis. Are you able to see here? Here they are talking about the giant cell tumor, osteoclastoma. It's affecting the epiphysis. And here you can see that giant cell tumor, what features you will have? Soap bubble appearance looks like, right? This image, if you look at giant cell tumor, osteoclastoma, you can see that there is honeycomb, or what type of appearance do you say? Soap bubble. The only good thing that is it is it's a benign condition, this one. Giant cell tumor, benign it is, and it will affect the epiphysis in the long bones, and it is actually causing what? Soap bubble or honeycomb appearance, right? This is about osteoclastoma. There will be bone destruction. Remember, there is bone destruction here. Fine. So that is giant cell epulis. So giant cell epulis, giant cell tumor, same thing, right? It makes sense now. So did you understand giant cell epulis? Now let's go on to the treatment of this. So you will have to remove this, okay? Small tumor means you can curettage. Large tumor means you have to radically excise, okay? Now let us go to the carcinomatous. Carcinomatous epulis means what will you see? Some carcinomatous growth is growing on the gum. So this is an epithelioma arising from mucous membrane of alveolar margin. See, it is like it is upon the gum is fine, but so many things can grow on the gum. They are talking about the bone growth, they are talking about the mucous membrane growth. So this epulis is a very weird thing. It doesn't have to be, it can be bone, it can be some soft granuloma, it can be some fibrous, now they are saying it is an epithelioma from the mucous membrane. So it's just upon the gum, epithelioma from mucous membrane of the alveolar margin. This we know, that is where everything is, alveolar margin. Okay. Then, typically it presents as non-healing painless ulcer. Non-healing painless ulcer. It's a non-healing painless ulcer. Remember, it is painless. This condition is painless. We have already marked everywhere that it is painless. Okay, it's and we have come to this one now. Epithelioma, it is a non-healing painless ulcer. Then it slowly infiltrates the bone. That's why it is malignant, right? It is slowly infiltrating the bone. Hard regional lymph nodes are due to metastasis. Hard regional lymph nodes will be there due to metastasis. Treat with wide excision. Okay. Treatment, what you do? Wide excision includes removal of the segment of bone. Includes removal of segment of bone. So there will be a little jaw is removed, you can say. Okay. So in this you have looked at Epulis. So can you say the 4 types of Epulis? Yes, very good. Come on, start. We have the fibrous, which is the very common, very good. Then you have granulomatous, very good. Then you have the last one, we know carcinomatous. In between we had the giant cell Epulis, which has the giant cell tumor. Very good, people. Very good. So we'll meet you in the next video. Bye-bye.